Perfect. All right, perfect. So just to start off, basic information, how old are you, where you grew up, ethnicity, pronouns, and why you do what you do now.
Sure, sure. So I might forget some of those things. So let me know if I leave anything out.
Yeah.
So my name is Stephanie Chervinko, and I'm a 53-year-old white cis woman. And I use she, her pronouns. And let's see, why do I do what I do now? So I have been working in the field of college student mental health for over 25 years. And all of my kind of training and experience has been through universities and university counseling centers. I really enjoy working with kind of the developmental stages that are kind of typical for college students. I understand that, certainly anyone of any age can be a college student. We tend to have a lot of kind of more of what we would think about as the traditional kind of age college students that are at Chico State where I am, and I really enjoy working with that developmental stage. I also really believe in education. And this is one way that we can reduce barriers to education is by, doing mental health work. And I think, why mental health as opposed to kind of other things is I've always wanted to be a psychologist. I had a little bit of a kind of circuitous route to get to where I am, but I think, enjoy working in a very relational way. I'm a very relational kind of person. I think therapy is, very much relationship driven. And it's rewarding. It's meaningful. I think also, some of my attraction to the field and to this population is also kind of rooted in some of my own kind of struggles and things that I had when I was, at that stage and going through college. And, so I think there's also something with that. I grew up in a university town. And so there's also just a certain level of comfort and familiar, the word. I can't seem to say that one.
I know.
With being at a university and being in that environment. So I think there's multiple things that have sort of brought me to where I am today.
Mm-hmm. And where did you grow up?
I grew up in a town in Southern Illinois called Carbondale. Okay. And it's home to Southern Illinois University. So gotcha. Yeah. Mm-hmm. Yeah.
Okay, so now getting into body dysmorphic disorder.
Mm-hmm.
In your time working with students, what communication skills are most important when treating body dysmorphia?
Communication skills. Well, I think empathy is huge because I think, that to me is really kind of one of the foundations of just doing clinical work in general is really needing to be able to sort of decenter from myself and kind of step into the shoes of another person. So not just what do I experience when I'm sitting with that person, but really what is it that I have come to understand this other person is experiencing it and really being able to kind of see things from their perspective. I think that being able to validate someone's experience without necessarily endorsing maybe the disordered and underlying beliefs, right? So the feelings, I will say, and I kind of stole this from Tara Brach, who's a mindfulness-based psychotherapist, who she will say the feelings are real, the beliefs are untrue. So I kind of work from that framework in terms of, what the feelings really are. So I believe in a lot of validation. Let's see, I'm trying to focus more. I don't know if I'm strictly focusing on communication skills. I mean, certainly open-ended questions and, things of that nature. I think that kind of rolling, in some ways we sort of talk about in this business, rolling with resistance. So not working against resistance, but really being able to kind of come at it from a place of understanding why someone might be struggling with letting go of some of those beliefs, or, adopting a new way or new perspective of seeing themselves.
Mm. And what communication skills do you have with working with other healthcare professionals as well, in relation to body dysmorphia?
Yeah. I think just, being able to be kind of open, direct, flexibility, again, kind of willingness to hear different perspectives. Yeah, I would say that those are probably the kind of primary things that I would be able to do, be able to kind of, summarize, and yeah.
Mhm.
Mhm.
So depression, I think depression overall can be genetically passed down.
Mhm. Mhm.
And so with body dysmorphia, and that being body dysmorphic disorder being a mental health condition, and depression being a mental health condition, do you feel that body dysmorphia is more behaviorally induced or genetic?
I'm gonna have to say I can't say that I really kind of know for sure. Like I said, I don't consider myself necessarily an expert in body dysmorphia. It's certainly something
Yeah.
that I've kind of worked with, but
Mm.
I don't know that I'm sort of as up on the current literature with that to be able to say here's kind of what the current literature is saying in terms of whether it's something that is hereditary or kind of more learning. My sense of a lot of mental illness is it's both and.
Okay.
And I know that with regard to eating disorders, and body dysmorphia kind of falls within that, that we often sort of say, genetics loads the gun and environment pulls the trigger. In other words, genetics can give somebody a predisposition, and then there can be environmental things that may then kind of activate that in someone. And I think that's the case for some other kinds of mental health issues as well, and that it's not one cause.
Okay.
It's really much more complex and a multitude. We often work from what we call kind of a biopsychosocial model, which is looking at biological components, social components, and then internal kind of psyche components.
So they go hand in hand, you would say.
Yeah, I think that each has something to contribute, and kind of pulling that apart, and what's contributing how much. I'm going to leave that more to the research experts to kind of talk about.
Mhm. So when working with students, what what have they said is their main reason for feeling this way towards their body, or feeling
Mhm.
disconnected from their body? Is it the impact of social media now, family
Mhm.
upbringing, things going
Mhm.
on in family, bad self comparison to one another because we have this ideal body type? What is
Sure.
what is
Sure.
it?
Yeah, so I think people will tend to talk more about the environmental influences, right? Because that's what they're seeing and that's what they feel most impacted by, right?
Mhm,
So they will talk about those things, and again, those things are certainly a factor, right?
mhm.
And if it was solely caused by, say, social media, then we would all have body dysmorphia, and
Yeah.
that's simply not the case, right? But
Mhm,
those are the kinds of things that people will talk about and that they will grapple with, because those are the things that can trigger, activate, and influence. So if you are somebody who is already maybe sort of genetically predisposed to have a distorted view of yourself, or to kind of think of yourself in that way, maybe to have maybe some obsessional kind of thinking, and then it gets kind of targeted on your body, a particular, and again, body dysmorphia can be related to kind of size and shape, but body dysmorphia can also be related to a particular feature, or so it's
mhm.
not, I think we often associate it with size and shape because that's certainly something that's very prevalent just in our societal ethos, and people can fall along the continuum of just struggling with body image and things like that. But body dysmorphia can also include things like, perhaps I'm seeing my nose as, grossly distorted when it's not, right? So it's not
Yeah.
always just kind of size and shape. But yeah, I think people will kind of talk more about the influence of social media, family, social comparison, those kinds of things.
Gotcha.
Yeah. And so
Um,
we do talk about that. Yeah. Mhm.
yeah. And in your time working with students, what has been the main gender that comes to you? You know, female,
Mhm.
male, non-binary, transgender.
Yeah. So I would say in general, overall, I probably see more female identified individuals. And then if we're talking about kind of, body image, body dysmorphia, again, I think more female. Although certainly have worked with males, and I know that that it is a concern. When I used to run a group making peace with food and body, that kind of looked at food and body relationships, and often it would end up kind of being an all women's group. But there were a few semesters where I had some men that were a part of male identified that were a part of that group. I have also had a couple of students who are transgender who were a part of that group before in the past as well. But I would say probably the majority is women.
Mhm. Um, and when you're working with students, what actually I'll ask this question first.
Mhm.
You know, the impact of the COVID-19 pandemic made us all virtual, and now most of therapy sessions are now virtual. But
Mhm.
I go to therapy as well, and I think that therapy in person benefits me more than
Mhm.
virtual, but they still do pretty well
Mhm.
together. But
Mhm.
as far as specifically working with students that are dealing with body dysmorphia,
Mhm.
what has been better therapy for them, in-person therapy or virtual therapy?
Yeah. I don't know that I've sort of had enough people kind of during that period, but just sort of thinking about it in general, I don't know that I would sort of come out saying one or the other, because I think a lot of it can depend on the individual. So, for some individuals, their body dysmorphia may be so severe that they have difficulty leaving their home or aren't able to leave their home without
Mhm,
taking hours of preparation. And
mhm,
so in that case, being able to provide virtual services might help increase access, right, and
mhm,
willingness to participate. So in that case, I would say, having virtual services would be better, right?
mhm,
So in that case, I could see that. For other people, I could see where you might sort of get to a point where maybe working on coming into the office, being in public, right, might be part of the worked in part of the therapy or part of the treatment plan. And so in that case, you might be working towards more in-person work. So
mhm.
so I think there's both, and right, certainly I
Yeah.
think, having done therapy both ways, there are ways in which I can kind of read full body language, nonverbals, subtle things, just energy much more effectively in person versus online. And at the same time, though, I think, being able to provide services online has certainly expanded access. And so, yeah.
Mhm. And dealing with students with body dysmorphia, what do you usually do during your therapy sessions?
We will sort of look at kind of some of the functioning of the beliefs in the body distortion. We will work on not necessarily is this true or is this not true, but more of a how do I start to unhook from some of these kind of thoughts and distortions so that they may still be there, but they are maybe not controlling my behavior as much.
Mhm,
So I think there's a difference between, you know, what we think and what we feel, and then how we act, right? And so we
mhm,
may not completely eliminate the thoughts or beliefs. They may still continue to show up, but can I learn to cope with them in a way that I can still engage in kind of a full and meaningful life? And so those are some of the things that we will look at, but we will also kind of look at how this functions for someone, right? Oftentimes these things can develop in part as a way to cope with or avoid unpleasant feelings, trauma, things like that. So we'll look at some of those things as well.
gotcha. So now I'm going to give you some stats on body dysmorphia. So these were recorded in October 2020 by the
Mhm.
Cleveland Clinic, and they estimated that 5 to 10 million people are diagnosed with body dysmorphia. What's your thoughts on that?
I mean, I have, I don't know that I have any particular strong thoughts. I'm not sure kind of what you're wanting to know in terms of my thoughts. I mean, I'm gonna guess, that it's accurate depending on how they did the research. I
Yeah.
don't know if that's necessarily an increase or a decrease, again, increase can sometimes be reflective of, kind of doing a better job of
Yeah.
identifying and diagnosing. So, yeah.
Mhm. No, just it's just more of your, I guess, as far as like working with, patients with body dysmorphia and seeing it, as maybe more seen in people
Hmm.
nowadays, and it's
Hmm.
just maybe under um what's like under recorded, I guess.
Yeah.
Like,
Oh, yeah. I'm sure. I mean, I think that's the case with a lot of mental health issues is that it tends to be underreported. I think,
yeah,
particularly when we're talking about eating disorders, body dysmorphia, I think in particular it can be underreported among men because traditionally it's kind of been thought of as a women's issue. And so there can be increased shame. Although I have seen more and more attention sort of being paid to men and body image, and particularly with regard to some of the things that are being put out on social media around sort of extreme bodybuilding and things like that. Like things like that can also be a form of body dysmorphia. So, yeah.
yeah. So the International OCD Foundation kind of broke it down percentage wise and said it's
Hmm.
body dysmorphia affects 1.7% to 2.9% of the general population. So,
Yeah.
and they do put it in there. There's probably more people out there just not recorded.
Right. Well, and I think with a lot of these things too, when we're using the DSM, so things have to reach a certain threshold to be able to, for us to sort of say like, yes, that's diagnosable. But I think we also experience people who may be struggling with, some version of body image or body dysmorphia that maybe doesn't quite reach that clinical threshold. Right.
Yeah.
And so that, kind of at subclinical level. So I think about things as kind of happening more on a continuum. Right. And so not everybody might sort of fit that diagnostic criteria, but it doesn't mean that they might not still be struggling with some kind of, distortion in terms of how they view their bodies. Yeah. And so so that it doesn't kind of surprise me that that's probably about the number. I mean, again, because I think when we're looking at some of these kind of, statistics around, mental health issues, they're kind of often in that kind of range. Yeah.
Mhm. And this doesn't have to be directed towards students
Hmm.
specifically, but what do you have to say to people um, that deal with some type of body dysmorphia but don't seek treatment, don't seek therapy to deal with the emotions, their feelings, their thoughts? What do you have to say to
Hmm.
people?
I mean, I think, if they're not yet ready to maybe seek professional help, I think, sometimes, maybe looking into some, kind of a self-help book or something like that, maybe some guided journaling or something if they're wanting to do some, exploration on their own. I think, depending on kind of how severe it is, that alone might not be enough for someone. I think, looking at the degree to which it might be, again, kind of limiting somebody's, functioning and ability to enjoy a full range of activities in life. And, I also would really empathize with, perhaps the fear that comes up when someone's thinking about getting treatment, right? It's one of those where there can be a lot of ambivalence and mixed feelings about getting better, because
Mhm.
it is thinking about sort of letting go of something that has really probably helped this person in a very deep way try to cope with some really hard things, right? But
Mhm.
there can be some other ways of coping that might not be so limiting for them. So, yeah. Mhm.
So those are all the questions I have.
Okay.
Any last thoughts? Anything that you want to put out there?
Not that I can think about. Can you share with me kind of how you're going to be using the recording? I guess I probably should have asked that before you started recording. Is it just more so you don't have to take notes or
Yeah, it's more, yeah,
Okay,
because yeah, because I have to put quotes in there, what you said
okay,
on this. Mainly
that's, yeah,
it's mainly, it's a health communication class. So
okay,
the teacher wanted to know like the communication skills that you use with patients. And so that's the main,
that's, okay,
yeah, so that's what I'm using it for. I would have
okay,
laid it out if I was going to use it for video or
yeah,
something like that.
okay,
So,
okay, yeah.
but yeah, but I will tell you the other person I interviewed, I didn't tell them because I actually didn't know about the part two of this research project, but we are making a health campaign.
Oh, okay,
So I didn't look over why we have to go to interview again, but I will let
okay,
you know and we'll do like a follow-up interview on that. And
yeah, yeah,
hopefully there's different questions thrown in there.
okay,
Um,
yeah.
so yeah, yeah. So I think that's everything for now. I think I'm good. Is it okay if I reach out? Um, should I reach out to a different email than the one that I'm using right now?
No,
Got
the
any
one that you
follow-up
use is
questions?
like, yeah, that's my work email. So that's the best one to reach out to. Yeah.
Okay.
Hmm.
Okay.
Yeah.
Perfect.
Yeah.
Well, I thank you, Stephanie, for your time and yeah, um,
Absolutely.
yeah, and we'll talk soon.
Okay. Sounds good. Take care, Adam.
You too.
Bye-bye.